Now, of course, Momentum is not the only company that has announced increases, but it really is a trend across the industry with that higher healthcare inflation coming in at about 2 to 3% above just normal inflation. And I also did catch up with ProfMed as well as MedScheme for some of the factors that are just affecting the industry at large when it comes to the increases in their memberships. Take a look at this package. Healthcare inflation has been on a rising trend, and it's projected that in 10 years, the cost could be as high as 2,600 Rand per member per month, compared to the 1,000 Rand today. The exponential increase in healthcare expenses far outpaces salary inflation, making it an urgent issue for medical schemes and their members to navigate.
We note that healthcare inflation outstrips consumer price inflation by probably 2 or 3%, and there's a few really key reasons on why that happens every year.
This includes advancements in technology and medicine, dollar-based high-cost equipment, immigration of skilled medical staff, and the burden of diseases driven by poor lifestyle choices.
Each year, we carry a heavier burden of disease. And as that burden of disease grows, it means that we need more healthcare services. And so we see people accessing or going to the doctor more times this year than they did last year. And when compared to 5 or even 10 years ago, they're actually visiting the doctor a lot more times.
MedScheme Health Actuary Sarah Bennett emphasizes that skyrocketing healthcare costs and unaffordable treatments are not unique to South Africa, but are a global issue, adding that while medical insurance is often a more affordable option, consumers must do their research.
The medical insurance is an option, but you must remember that the coverage is not as comprehensive. And equally for any low-cost benefit option that may be introduced, it would need to be exempted from the prescribed benefits, so it wouldn't provide as comprehensive coverage. So I would just advise consumers to purchase wisely and just make sure that you know what is covered and what is not covered.
She concludes that collaboration in the industry is important in order to balance the rising costs of healthcare providers with annual fee increases and members having access to the correct quality services.
How can we ensure that more people are covered in South Africa? There is talk of the National Health Insurance, which is hopefully going to improve coverage. We do have a National Health Service in South Africa, which has its challenges. But ultimately, we want to give the South Africans peace of mind that they are covered for their medical expenses.
Last month, Momentum Health Solutions announced a 9.6% increase to its medical aid packages and contribution increases for 2024, just one of others that have increased their fees. For Newzroom Afrika on Channel 405, I'm Ntokozo Khumalo in Johannesburg.